Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course.
Brad, how does it feel to have the skeleton taller than you? Even?
Yeah, you should talk
Even
about
dead guys.
Look at that.
Yep, I got him beat. All right, today, Brad, we're going to talk about the
shoulder.
differences. Yeah,
The
between.
shoulder.
Do you mind if I say it?
Say it.
Tendonitis, bursitis, and what's the last
Capsulitis.
one? Capsulitis.
Right. We actually had one of our viewers came with a question on this very specific question, so we thought, why don't we show them and give a real example of what we're talking about? And we're going to use the shoulder joint. You could have all these itises at different joints in the body, but we're going to go to the shoulder because it is a very common.
And what does itis mean?
Inflammation.
Inflammation. So
right.
that's what all three of these have in common. There's inflammation in a different anatomical structure.
Right. So in the capsule, it's the capsule.
In the tendon, it's the tendon, and in the bursa, that's actually when the bursitis, it's a bursa.
Right.
And we'll talk about all three.
Right. So let's start out. We've got the
tendon.
The tendon here, the model of tendon on the shoulder, and let's get this little red thing off there for now. We'll get back to that. So let's look at the tendonitis.
So a muscle is up here, and it narrows up and becomes this tendon.
Right. We're not doing an anatomically
I'm sorry, we're doing the bicep, aren't we?
Right, yeah.
The
bicep muscles down here. But either way, the tendon goes right through this groove, and the tendon's not black, by the way, but just so you can see it on the film.
It actually attaches up in here.
Yeah. So when things contract, you can see, can you see that, Matt? Can you see that tendon slide
up and
through
down.
there? Yeah. Now what happens when that works and gets overworked is this tendon can get irritated, and then it can get inflamed, and there you get the itis.
Right.
And if you continue to use it, say you're doing a job in a factory, and it's one of these repetitive jobs, and you have to get your work done, obviously, until you go home, you might irritate it like this throughout the day, go home, and hopefully it gets better. Then the next day, you can go at it again. So that's tendonitis.
It can really get roughened up. It can go to the point you can actually sever it.
Right, right.
Yeah,
that's an extreme.
Yep.
The next one is we're going to talk about the bursitis.
Right.
Now, the bursa, there's bursa sacs throughout your whole body.
Yep.
And what they do is they lubricate a tendon or ligament from wearing out as it rubs over the top of a bone. This may not be exactly how it is in your body, but let's pretend this red piece of tape represents a little bursa sac.
Yep.
Bursa sacs are kind of flat, but they have fluid inside of them, and they provide the lubricant. So when a tendon would go back and forth like this, or it could go this way, but it protects and lubricates the tendon from rubbing on the bone and wearing out.
On the hard surface.
Right. And so what happens is the bursa can get inflamed, and there's nerve endings in there. When it gets inflamed, it starts pain, and it goes to your brain, and it says, ouch, which means you're overworking me. Give this part of your body a break.
Again, a small fluid-filled sac.
Right.
That
and
protects you from the bone.
It's getting inflamed, and it's saying...
That's a bursa.
Right. I had a patient once says, yeah, my shoulder's talking to me. He says, it's hurting, I need to stop. So that's what happened. Your bursa is telling your brain, hey, it hurts.
Shoulder bursitis is fairly common too, by the way.
Now, the next one is capsulitis. Every joint in your body has a capsule as well.
Yeah, it's a tough fibrous ligament that covers the whole bone like this and kind of covers it up and protects it and
it seals it right up.
Seals it up and it contains the synovial fluid,
right?
Like you said, Brad,
which lubricates the joint,
right, and holds it in.
To get a model for this, I got one of these balls, and you can see it's got this yellow fluid in there, which represents the synovial fluid. And if it could take this and put it right over the top of that shoulder, that's a good representation of the capsule.
Yep. Tough fibrous material it's made out of.
Right. And that capsule can get irritated as well. If you injure it, it can get some scar tissue on it and then get irritated. One way or another, it's going to affect your shoulder range of motion, and it's going to be painful as well.
Well, you hear frozen shoulder, and that often is because of the capsule, but there's also capsulitis.
Right.
Sometimes it happens for no reason. They don't understand why it does happen.
Right.
The capsule gets inflamed.
Exactly.
And that can last a year and a half, and then it gets better.
Right.
So it's just a mysterious thing that they really don't understand why it starts sometimes.
So one way or another, we were talking about this, is how do you treat it? Whether it's capsulitis, bursitis, or tendonitis. Oftentimes, if you've got pain in there, it gets treated the same, particularly if you're taking like NSAIDs or ibuprofen.
Right.
It doesn't matter where the tissue is irritated because it goes throughout your whole system and it gets at the proper tissue.
So you want to take some type of anti-inflammatory, usually a doctor's going to recommend.
Right. And with a therapist, do we have specific exercises for bursitis versus tendonitis? Typically not.
Typically not. A lot of the same things we're going to do. We're going to
Right.
stress the tissues without irritating them.
And strengthen the muscles around it, maintaining range of motion. It's really all the same.
Sometimes it's hard to distinguish which one it specifically is.
Right.
Is it a bursitis versus tendonitis?
Right.
You know, so we don't always know. We just go by how the symptoms respond.
Right, and
So
we don't always admit that because patients really like to know
they want to have
one
specific
thing
answers.
or another. But if you ask the doctor, the therapist, in a dark room, if they knew 100% sure, they'd say,
with a light on their face.
yeah, they'd say, no, it's just a pretty good guess.
And it could be that you have both.
Right,
You know,
sure.
or more than one, I should say.
In one way or another, they're going to get you better.
Right.
So
that's exactly right.
This is a whole complicated. This is almost as hard as fixing a broken heart, Bob.
I don't know if anything's that hard, Brad, but we'll try
Take
if
care.
you have one.